Welcome, everybody. Thank you for coming out tonight. My name's Kim Ash, and I'm the BSN Program Director here at the University of Jamestown. I would like to welcome all of you here tonight as we not only celebrate our incoming sophomore nursing students, but our junior and our senior nursing students as well that are sitting up here in the front. We're also very excited tonight to announce and welcome our third recipient of the University of Jamestown Nursing Excellence Award, Jami, Ogren, Falk, and acknowledge the accomplishments of our senior nursing students who are being inducted in the spring into Sigma Theta Tau Honor Society for Nursing. Tonight, we will also be recognizing a small group of our nursing students for their quick actions this fall that saved a life of someone very near and dear to all of us. But before we start, I would like to take 2 minutes to introduce some important people that are here with us tonight. First, I would like to welcome and introduce our nursing faculty and staff. So if you would please rise, and you can turn around and wave to everybody when I introduce you. We have Dr. Penny Breeze. Sherry Gunderson. Wendy Hager, Andrea Bonderud, Dr. Arian Closey, and Katie Webster. We also have adjunct faculty that help us out. I don't think I saw them come in, but if anybody knows Sydney Johnson from here in town, Nora Metler from Fargo, and Crystal, I'm drawing a blank now. Crystal Kropp from helps us with our clinicals at JRMC as well, so we want to acknowledge them. I also am going to take just a couple quick seconds to introduce 3 people that are here, 2 from administration and 1 faculty member that play a part in our student success here. If you would please rise, we have Dr. Paul Olson. He is the Executive Vice President of the university. Dr. Chris Redfern, Executive Vice President of Academic Affairs. Dr. Michelle Solinsky, who is a biology instructor who teaches our students A&P. And Logan Adams in the back corner, he is the university media producer, AKA the social media guy, who we appreciate being here tonight. And I just want to real quick ask, because I can't see, is Trisha Jungles here by chance? Yes, there she is, Trisha Jungles, if you would just stand for a quick second. Trisha is the recipient of our first Nursing Excellence Award in nursing, and she is the CNO at JRMC, and she brings her girl gang with her, and 1 imposter, it looks like in the middle there, from JRMC, and they are all just a huge support to our students when we have clinicals there. And last but not least, I want to thank and welcome the junior and senior nursing students for coming here tonight. We do have a couple who were not able to be here because of some evening classes for the character and leadership program that we're in. But I would like all of you to stand so our sophomores can see that it is possible to survive and thrive and come out alive from our program. So thank you. So, sophomores, why be a nurse? Think about that. What's your why? It's a popular question. You can even Google it, and I did. You could probably put it into ChatGPT these days, and it might also tell you. I don't recommend that, though. Some answers I found were career growth, diverse opportunities, flexible scheduling, and stable income. Other answers that I found to that question, which I love so much more, were to make a real difference in someone's life, to offer hope, to celebrate with our patients, to positively impact individuals, families, and communities, and to care for those in the most vulnerable times of their lives. All of these responses are true, and all of you have your own reasons as well. Many of you shared your why in your entrance essay, but whatever your reason, we are so honored and so grateful that you chose UJ Nursing. So sophomores, listen closely to this short list of things coming your way, and this is not all of it. 7 a.m. classes, labs, and clinicals, 4, 5, 8, and 12-hour clinical experiences at a multitude of sites such as JRMC, Central Valley Health District, and Carlson Center, North Dakota State Hospital, and Sanford Fargo, and that just names a few. Calendars and schedules that resemble a juggling act. You've already figured that out. I had so many emails already today on the second day of the semester wondering where we should be and when. So that's always fun to figure out. You're going to be holding patients' hands. You're going to watch life enter and leave the world. You're going to feel like you live in Our Lady McKenna Thielsch Nursing and Science Building, the library, and the study rooms. You're going to be learning. You're going to be learning a lot. Competency, practices, and checkoffs, high-fidelity simulations, care plans, care papers, quizzes, and exams, food by your professors, movie nights, laughing and crying, and you're going to do all of that with those seated right next to you here on stage. Remember when I said to you, make sure you have someone's phone number, your lifeline, right? You're going to call them and check in with them, and if they're not where they're supposed to be, we're going to help a friend and call them and say, hey, where are you? We also know you can't do it alone. This is something the juniors and seniors will attest to, and luckily for all of you, you don't have to. You have cheerleaders in your corner. We have a little something for you tonight. It's just a small token to pass on to your encourager and your cheerleader. Share it with them when you see them next. If they aren't here tonight, send them a picture and thank them. And with that, I would like to welcome Wendy Hager and Andrea Bonderud, who will introduce the nursing class of 2027.
So it is with, oh, can you guys hear me? I'm not that much taller than you, Kim.
Wait, don't break it.
Oh, don't break it.
Just grab the mic.
Okay, I'm just going to grab the mic. Okay. So it is with pleasure and excitement that we will now welcome the nursing class of 2027. These 14 students will carry on the tradition that began back in 1947 when Jamestown Hospital School of Nursing, now known as the University of Jamestown School of Nursing, faculty welcomed their first class of nursing students, all 5 of them. It was the first bachelor's degree nursing school in the state. We invite all of you nursing students to come to the area outside of the nursing faculty offices in Our Lady to see the wall hanging where Marilyn Salona Richter's original diploma hangs alongside a picture of her and the other 4 graduates from 1950. This is part of a tradition that you are carrying on as a future Jami nurse, and we are so proud of you.
All right, I'm going to help you.
Oh, you have
We have to be in the right spot for photo opportunities. All right, so as your name is called, please come forward to receive this small token of gratitude. We invite you to share it with someone who has inspired or supported you on your journey, honoring the impact of their encouragement in shaping your path. All right, are we ready? Lauren Anderson. Mara Bjornson. Amanda Birch. Tate Grossman. Aspen Hill. Riley Joseph. Briley Lingen. Gloria McKeown. Samantha Muller. Shamso Ruge. Rage, sorry. Oh, did I skip Corey? Corey Puga. Adria Stahl. Addie Wells. And Kennedy Wendell. Sorry, Corey. All right. It is now my pleasure to welcome Dr. Closey, who will present the 3rd Annual Nursing Excellence Award.
Well, it is my absolute honor and joy to announce again the recipient of the 3rd Annual University of Jamestown Nursing Excellence Award to Jami Ogren Falk. She is UJ Nursing Class of, 2002. Now let me tell you a little, but looking at her bio here, it's going to be a lot about Jami's esteemed career. So she is currently Chief Nurse for Primary Care Monitoring and Oversight for the National Office of Primary Care within the Veterans Health Administration. The VHA is America's most extensive integrated healthcare system. They provide care to over 1,000 healthcare facilities, including 170 medical centers and over 1,000 outpatient sites of care, varying in complexity. Currently, there are over 9.1 million enrolled veterans each year. Within her 20-year career with the VHA, she has held multiple positions. She has served as a frontline ICU staff nurse, an ICU and dialysis nurse manager. She was acting inpatient mental health nurse manager and associate chief nurse of primary care, acting Veterans Integrated Service Network 23, primary care nurse consultant and PACT coordinator, acting Department of Veteran Affairs Central Office clinical educator. She was also the quality manager and community-based outpatient region clinic manager within the Fargo VA healthcare system. Prior to her VA career, she worked in women's health as a labor and delivery newborn nursery nurse at St. Mary's Regional Healthcare Center in Detroit Lakes, Minnesota. Over her past 13 years in the ambulatory setting, she has played an integral part in leading the development and establishment of primary care nursing practice guidance across many facility, regional, and enterprise-wide healthcare systems. She has led multiple transformational coaching initiatives that focused on the advancement of population health, chronic disease management, and post-discharge contact quality improvement efforts. Ms. Falk is passionate about working with underserved populations, improving opportunities and access to women's health care, and advocating for bridging gaps in rural health through telehealth modalities. Ms. Falk is an executive expert who provides oversight in delivering efficient, safe, and effective nursing practices by leading process improvement teams that focus on quality outcomes through change management strategy. She holds an undergraduate degree, a Bachelor of Science in Nursing through University of Jamestown, and a postgraduate degree, Master of Science in Strategic Leadership through University of Mary in Bismarck. She holds her certification as a Certified Nurse Manager and Leader through the American Organization of Nurse Executives. When she isn't working, You will find her volunteering her time to multiple nurse and healthcare advocacy groups, including the American Association of Ambulatory Care Nurses, American College of Healthcare Executives, and the American Nurses Association. She is a proud wife for 22 years and has 3 amazing sons. She loves to travel and enjoys exploring the great outdoors through hiking and photography. She frequently visits national parks with her family. Additionally, she's an avid reader and enjoys listening to audiobooks. Ms. Falk values conversation and cherishes time spent with her friends and family. Now, Jami, though it's been a while since we last saw each other, over a decade or more, yes, for sure, I still vividly remember your bubbly and warm personality that could light up any room. Your sweetness and genuine care for others has been inspiring. We shared more than a few laughs, and we did get into some shenanigans, created memories that I cherish to this day. Your dedication and compassion in nursing have touched countless lives. You're devoted to improving patient care, advocating for patients, families, and communities. And tonight we recognize you for your exemplary service to the nursing profession. I'm so proud to see you recognized for your incredible work. Congratulations, my friend.
What a special surprise, Erin. Well, I'm short too, so it's a good thing we can put this a little bit lower. Erin graduated the year behind me from University of Jamestown, so what a sweet surprise. Thank you. Thank you, Kim. Thank you, Sherry. Thank you, Erin, and all of the University of Jamestown nursing faculty. Your time and contributions to growing and preparing nurses is a talent and a skill that doesn't go unrecognized. Amidst the shortage of nursing professors across the country, the University of Jamestown is lucky to have such a dedicated team of educators that continue to innovate, inspire, and graduate with high success rates and placement rates. So thank you. I am honored and humbled to be one of the nurses that was grown from this program. This university is dear to my heart, as I am one of 6 family members who has graduated from this prestigious academic institution. Thank you for the invitation to be here this evening to recognize and celebrate the newly accepted sophomore nursing students here at the University of Jamestown. I remember this moment and how special it was, and I thank you for allowing all of us to be here to celebrate this beautiful celebration with you. It's been a lot of hard work, hasn't it? And you're just starting, so keep up that motivation. Be proud of the knowledge you gained thus far and be open to continuous learning moving forward, and don't forget to ask for help when needed. See those juniors and seniors over there? They are your allies, they are your friends, they are your role models, and they need to be your lifeline, right? Because you don't get through nursing school without the support and of not only your friends, your colleagues, but your family. So keep that in mind. So I've been in the field for 22 years. I am one of 3 daughters, originally from Linton, North Dakota. So small population, tiny little spot of North Dakota. There are only about 1,500 people, so very small and rural, but I loved growing up there. I was raised actually by 2 educators, so I have a special love and appreciation for educators. My father, Corbley, he was a high school principal and a high school superintendent, both in Linton, North Dakota and in Zeeland, North Dakota. And my mother, Carol, was a 5th grade teacher and a huge science advocate. There wasn't a science experiment or project that she didn't make us do or make the grandchildren do. So it was a great, great learning opportunity. They are retired now, but they were college graduates from Valley City State University many, many years ago. And so they made the wise decision to choose the best school for their 3 daughters. So here we are. And so a special thank you to my mom. I just have to kind of thank her. She did drive all this way with me today, and she's been a supporter kind of through every phase of my life. I had quite a few phases, right? The bio sounds like I was something special, but I'll tell you, I loved to kind of rebel and have fun. And those of you that know me from my college years, I do have to be honest, like, let's keep that down low, because we enjoyed life and we enjoyed college, right? But it's every phase of life. And so Mom prayed a lot for me, and it helped. And so nothing like faith, family, and friends. Keep that in mind. My sister, Janisa Feist, she was a graduate from University of Jamestown too, and she's a third grade teacher in Washburn, North Dakota, at the elementary school. And my sister Julie, who's here in the audience as well, Juliana Lindgren, she's a primary care nurse manager also at the Fargo VA. I do tease her a little bit, letting her know that she followed her big sister everywhere. She kind of followed me to college, and then she followed me to the VA, and there's a little bit of a joke. I think quite a few of the college professors, I know Terry's here, they used to may have called her my name a few times, even at work or at school, and so I just have to make a little joke about that because, it's good to remember those things. So as we're looking at our professional identity, you do have to look at who you are at work and who you are at home and really blend what that means to be a nurse as a profession. And so I know many of the identities are based on values and ethics and knowledge and leadership and professionalism, but you also want to be able to find joy, right? We have to work on what is called work-life balance, and these long hours that you're in school and the long hours that you're spend studying, it will be important to carry that over into your nursing career, but you also have to know how to balance that work-life balance and how to have time to also relax and exercise and take care of your well-being. Because if you don't, burnout will set in, and we've noticed that more in the healthcare setting. And so make sure that you prioritize that. Make sure whatever you're giving, there are some limits as well, because in caring professions, it's great to care about others and to give, but your cup has to be filled so that you're taking care of yourself as well. I want to talk a little bit about the support from the college. One of the key moments and key things is, and I heard them say this, check on each other. Make sure that you have phone numbers. I think that shows just really what the culture is at this campus. And it was one that's existed for many, many years. Back in 2000 it was, we started, I was a junior, I think it was in 2000, I was a junior in nursing school. And we started our family a little bit earlier than we planned. And so I think I was going to be welcoming my first son. He's actually 24 and in the audience today. And I welcomed my son over Thanksgiving break. And so it was about the shortest maternity leave ever, I won't lie. It was a total of 5 days, right? And that was post C-section. And through the love and caring of Vicki Sand, who worked for the University of Jamestown, Barb Mickelson, and Terry Rittenbach, who was my advisor, I learned how to navigate and balance being a new mother, along with being a full-time nursing student and working about 20 hours a week at the Jamestown Hospital and nursing home. So, you're going to run into challenges. You're going to run into times and experiences that might throw you for a loop. The key is how you embrace that, how you lean in, how you welcome your family, your friends, and the support that they offer to get through those tough times, but also to grow and learn from that. And so make sure that you keep in check and you're there to support others who need you as well. It's a big priority for success. I want to talk a little bit about the why. I know my family has a strong family history in military service. Little background, it might help you to find your why. I know you talked a little bit, Kim, about why people chose nursing, but as you're starting your sophomore year, and even to you juniors and seniors in the audience, as you're starting to look at what your career will look like or where you want to work after you graduate, you need to start reflecting back on what your values are and finding places that align with what your goals are for organizations. So my grandfather married Ogren. He was actually a World War II veteran, and he was my hero. He actually is who I selected to do my pinning ceremony when back in 2002. He was a man who has dedicated his life to community and service, and he modeled this through many of the ways he volunteered, through the military, the fire department, Boy Scouts, and much more. And he modeled service that was very similar to what my father did. And my father spent 39 years in the North Dakota National Guard. He actually was in the engineering brigade, and he actually was the first person who asked me to apply at the VA. I actually didn't know what I wanted to do. I was looking into women's health and worked in labor and delivery, but having someone who motivates you and says, you know, what are you doing for those that served? It matters. And finding a mission and value and finding your why, it makes a big difference in how you align where you want to work. In addition, my sister Juliana served as an Army medic in the North Dakota National Guards, and she also motivated me because I wasn't able to serve. I played high school basketball, and I actually played basketball for the University of Jamestown, but despite 2 ACL repairs, the military didn't want me, so they wouldn't take me. So I guess I dedicated my time to nursing school and then to the VA. There's just so many opportunities, though. You want to make sure that whatever you're seeking for your future, it aligns with your goals and your mission and your values, and you want to go somewhere that has that alignment for your purpose. And you want to go somewhere that has joy too, right? And you see positive interactions and a positive culture and a place where you can thrive and grow. And there's a lot of organizations that will do that. I know Trisha's here from Jamestown, and she's got a great program at the Jamestown Medical Center here in town. And you want to strive and seek that, because there's a lot of places that'll give you sign-on bonuses. They'll say they'll pay you the highest wages, but you have to balance out what culture means, what work-life balance means, and really what they will do for your career growth and opportunities for education and advancement. And so all things to think about, and I know it sounds like a lot, right, for you sophomores, but it's never too early to kind of plan those moments. And some lessons, I think the biggest lessons that I've learned are probably from my failures. And I know that's not easy to say, because often people don't like to admit when they fail or when they do something that didn't turn out or it didn't work very well. And I welcome them, right? Because it means you tried. It means you put yourself out there and you attempted something in the best intentions of making a difference. And so it's okay to fail. And I say that very broadly because you always can pick yourself up and choose a different direction or be open to feedback and a different perspective and still have opportunities. And so most of the things will come from something you didn't plan. What helps you through those lessons really are coaches, mentors, advisors, and friends who will be honest with you. You don't want the friends that are just going to tell you, oh yeah, everything's fine, right? Or it will be okay if you do it this way. You want those friends that are very honest with you while still caring about who you are as a person. You got to think about who they are. You have to think about building those relationships. Many of the college friends that I made are still my friends today, and I met them here through University of Jamestown. They were in my wedding. They're part of my life as we speak. And so, pick your friends, choose them wisely, be honest, be the honest person for them as well. This will broaden your mindset. It'll open you up to new policies and ideas. And you just want to have grit and determination. to build relationships, and to return the favor. It fosters the continuous growth and enhances high reliability organizations, and that's really, really important. And some of the advice I learned working as a CNA at Jamestown Medical Regional Center and the nursing homes here in town are be kind and respectful to everyone, from the housekeeper to the maintenance men to the CEO. Listen, but speak up and advocate when it's needed. You never know when that will come back to reward you, but it's a key point. Wearing your white coat or getting your pin, it doesn't mean that that you're above any other member of that healthcare team. And so you just want to keep that mindset, because it works when you need teamwork or you need things to get done in your roles after college. Other items that are very important is do not participate in lateral violence, right? We know this is a big topic in healthcare organizations. It's a big opportunity, and I know from the culture at Jamestown, I'm sure that isn't happening, but even being the person who stops it and helps others grow and helps people navigate through those challenges, it's something that there's a lot of money spent on in healthcare entities right now on how to reduce bullying and how to reduce the lateral violence that occurs. You know, if we're all here to help grow others, that should be our mission and our purpose. And so those cycles will be broken if we can stand up and protect fellow nurses and colleagues. Also, choose your battles wisely, because everything can't be a problem or an issue either. Otherwise, nothing will be a priority. And so I say that with a learning moment on, right? If everything is something that you want to point out to leadership or to management or to your professor, they're going to lose faith in your critical thinking skills. So you have to really choose those battles wisely and prioritize what it is you're focusing on and how to make your point in a clear manner. I've had opportunities I never even dreamed of, because to be honest, 22 years ago, they didn't exist. And so there's things like telehealth and virtual blood pressure monitoring that I've been able to be a part of. And when I went to school and graduated way back in the 1900s, as my son describes it, those didn't exist. And so you might have ideas right now of joining and wanting to go into ER nursing or ICU nursing, and I welcome you. Come over to primary care, right? We'll take you. And there might be jobs in data mining or looking at data and analytics or remote telemonitoring for different ICU rhythms that pose new opportunities and new career paths. And so, you know, keep that in mind and always grow and learn and be open to those new ideas that may not even exist right now. It might open doors for you someday, just to be flexible and adaptable and open to that. Recently, I had the opportunity to co-publish an article, and I'll be honest, that was never on my dream list. I never ever thought I would do that. I kind of shied away from that. I didn't think I was good enough. I didn't think I was capable. And I challenge you, what might not be your goal now might be your goal in the future, just because a mentor or a coach or somebody opened that door for you. So just be open to those opportunities. Say, maybe not today, but maybe in 5 years or 10 years, you know, and welcome them with open arms, because someday when you're 22 years out of your career and you were from the 1900s, right, it might be relevant, and it might be pretty fascinating to look at what your research did to promote and share practices across different entities in the nation. One other area that I wanted to just talk about that's been a huge passion of mine is getting involved as a volunteer for professional organizations. One of my closest mentors invited me to be an active member of the American Academy of Ambulatory Care Nurses. And I was like, oh, I don't have time for this. You know, I'm a mom and 3 boys and run into sports and, you know, working full time. And how will we manage this? And it started out as like 1 hour every Tuesday night. and it was manageable. It actually worked, right? And it was on a task force that allowed us to develop a new nursing sensitive indicator roadmap. And that was so interesting to look at how we're measuring the contributions of nursing work that's done, and how we can evaluate outcomes and improvements in patient care based on those outcomes. And it was eye-opening. There were nurses from all over the world, from Canada and from Australia and from South America, and they all had novel ideas on how we could look at measuring the nurse work and how we could measure outcomes from implementing bundles or checklists or task lists that can make standard work operate more efficiently. And I was so excited about it, and it really was something that I wanted to turn down. And so really think about that when a door opens and somebody says, give this a chance, get involved, be active, and prioritize some of these growing lessons. And now it's turned into being on a planning committee for the 50th anniversary event in San Diego next year, and they're paying for it, right? So that's a huge promise, right? That's a huge bonus. So, you can do 1 hour. If I can, I know you all can. And I welcome it because it gets you involved, and it gets you into legislative opportunities and learning about how to advocate for your nursing profession. And I know right now that might not be your goal, but it might be later when laws are made that change what your practices can do, or when you're trying to make sure that nursing doesn't get bundled with the housekeeping charges, but rather we want to bill for independent nurse visits, because that makes a difference when you do chronic disease management for CHF patients or for diabetes patients. And we want to make sure that those nursing billing codes and CPT codes can capture all of that work and that contribution to care, so that we don't get lost in the costs of healthcare that are hidden within organizations. And so I plead with you, get involved, get active, and be very promoting your profession through different lenses and different levels. I want to share a couple more items because I don't want to keep you too long. I know that we have some amazing things coming after this. So there are well-known contributions to stress and discontent, right? We have economic hardship, and we have worries about the future. There's negative headlines that dominate our feeds, but one key for success is to turn off the noise and focus on what matters. On doing the right thing, being an advocate, and knowing you as a nurse, as an RN, you're a highly sought after profession amidst many shortages within healthcare. So be selective, choose positions or roles that value nurse contributions, know your value and worth, and look for culture that will bring you happiness and that you can bring joy to work. I know that this will help you to surround yourself and to make your career long and worthwhile. The U.S. Surgeon General, Vivek Murthy, he's actually someone that I got to listen to, and I admire him. He was speaking at the 2023 AMSIS conference in Maryland, and he's responsible for sharing scientifically based information with the public to improve overall health. He's focused on a passion of mine, which is health promotion and disease prevention, and the culture shift of focusing more on prevention and healthy choices in America is a major opportunity that we all have. This can reduce the ever-growing healthcare costs, but unfortunately, he's closing out his second term within the next couple of weeks. He left some wise words for our country that I wanted to share with each of you today. And these are his words. After he's reflected on many of his travels and the stories that he's heard, he delved into scientific data and different research. There's actually 3 essential elements that fuel the fulfillment and well-being. And these 3 things I want you guys to take to heart. They are relationships, service, and purpose. Relationships keep us grounded and bonded to each other. Service, whether it's formal volunteering to informal small acts of kindness, it's about helping each other and helping those in need. And purpose gives our life a sense of direction and meaning. Together, these elements, they really form the triad, and they help us to center our lives around relationship, service, and purpose to have a path for health, well-being, and fulfillment. And so I just bring that up because I think it's wise words for us to hear. We work a lot on curing and improving disease that's already created, but we have to shift that focus more on prevention and wellness. And I think you are the students of the future that will have this big mission to focus on. And so I just want to arm you with some of that knowledge. And so you have the power to make a difference in patient and family members each and every day. Please dig deep, embrace your compassion, and use it to guide your care. Never underestimate the impact of a kind word or a gentle touch during any time that you're caring for a patient. Be the nurse you would want for yourself or your loved ones. Your dedication and knowledge will help you navigate the challenges and celebrate many victories. And remember that learning is a lifelong journey, so stay curious and ask a lot of questions. You're a healer and an advocate and a source of hope for so many patients. Take care of yourself so that you can best take care of others. Set new goals every step of your career, and if things aren't working, please look at changing the direction. Don't keep doing something that doesn't work. And it's okay to listen to other perspectives, and they might not always be the ones you're thinking of. It's okay to have that and listen to that. And in closing, I want to welcome you to the incredible path of becoming a registered nurse. You're one step closer to your goal. You have chosen a path where you can make a profound difference in the lives of people every day and in yourself and your family. Embrace the challenges, trust your instincts. Always remember the compassion and care you bring are invaluable. I want to end with a quote from Terry St. Cloud, and she said, "And if, when it's all over, I'm asked what I did with my life, I want to be able to say, I offered love. A love for nursing, a love for caring and improving healthcare, and mostly a love for fostering relationships, service, and finding purpose." Thank you, class of 2027. I'm excited to see your journey and to work with you or receive care from you in your future. Thank you for the opportunity to be here today and for being recognized as the third recipient of the UJ Nursing Excellence Award.
Jami, I just want to thank you so much. This is my second time hearing her speak. She came and spoke for us for Sigma before, too, and I just appreciate your wisdom so much. And we want to present you with this gift.
Thank you.
And thank you so much. There's a lot, maybe you don't even have to hear this next semester because she's shared so much with you.
There's a plaque under there, too. Oh, the bubble wrap. Bubble wrap. Oh, thank you. That's very nice. Thank you so much.
We're going to move on to a Sigma presentation and announcing the Sigma Theta Tau inductees. They'll get their certificate from Dr. Breeze and be given a cord that they will then wear for graduation. These Sigma inductees are going to miss their March induction ceremony because they'll be on practicum. So As the president of the Xi Kappa chapter, I just want to be able to recognize them tonight. So in honoring them, into the Sigma Theta Tau Nursing Honor Society, Sigma recently had its 100-year anniversary and has a mission to develop nurse leaders anywhere to improve healthcare everywhere. The vision is to connect and empower nurse leaders to transform global healthcare. The official induction then is in March, but some of the reasons why they have been asked to come into the Sigma Honor Society is because they have completed half of their nursing curriculum and they're ranked in the highest 35% of their class or have a 3.5 or higher GPA. For those of you who didn't meet that criteria and aren't being inducted tonight, know that you can join as graduate nursing students or as nurse leaders later on in your career. Once inducted, they become lifelong members of Sigma. So I'll now invite each one up as I call your name. First, we have Skya Brandon. She's from Hatton, North Dakota, and she is interested in the ICU. All right, and then we've got Brooke Biergard from Bismarck, North Dakota. And she is interested in the neuro ICU. Then we have Kylie Herman, and she's from Jamestown. And interested in long-term care. Someday she'll get to take care of me. Kylie Lingen is next. She's from Thief River, Minnesota, and she is undecided between pediatrics or labor and delivery. Paige Maynard. She's from Billings, Montana, and she's between ER and ICU. Megan Oswald. She's from Austin, Minnesota, and she's looking at ICU and then to the future as a flight nurse or a neuro nurse practitioner. Lexis Page. Lexi's from Carrington, Minnesota, and interested in labor and delivery. Carrington, North Dakota. I said Carrington, Minnesota. Shame on me. Okay, Tessa Page. From Carrington, North Dakota, and interested in pediatric oncology. Yep. Congratulations to the Sigma Honor Society inductees of 2025.
Oh my gosh, my cup is full tonight. I just love this. It's just like so much to celebrate. And Jami, your words were just perfect. Absolutely perfect. I didn't actually know, or I didn't remember, I can't do this, when I asked Arian to introduce you that she knew you. So that was a nice little surprise for me. Now I do know that Tricia and you graduated together from nursing school. So it's this little trifecta going on that I had no idea was taking place tonight. So it's just so much fun. And hearing you talk about your college memories, I was thinking of my friends from college that are still my friends. And it's true, you guys, you have to find some redeeming quality in all of you up there because you're going to be together forever. One of my first nursing friends actually went to Kenya with me 2 years ago when we took the senior nursing students. That's how close you get. So it's just kind of fun to see all this come into play today. So fun, and your words were just perfect. I loved them. Thank you. Tonight, I'm going to see if I hope I have a Kleenex up here. I hope I don't need it, but it's possible that I might. Okay. Tonight, we're not only celebrating our incoming sophomore class of nurses, our inductees into Sigma Theta Tau Honor Society for Nursing, but we're also going to celebrate some very extraordinary actions of our nursing students who demonstrated quick thinking, compassion, and professionalism in a moment of real crisis that we had on campus here this fall. It was during what seemed to be like a very routine day. Would you agree? Right? Very routine day on campus when the unexpected event occurred. Dr. Terry Rittenbach, our beloved nursing professor with an astonishing 47 and a half years of dedicated service to the University of Jamestown, known to all of us as simply Terry, experienced a medical emergency during an EKG study session that she was leading. Recognizing the signs and symptoms of a stroke, 5 senior nursing students in the classroom, Allie Battistoni, Kennedy Johnson, Aislinn Jordan, Megan Oswald, and Emma Pickrell, and 1 senior nursing student, Skya Brandon, who was passing by in the hall, all acted immediately. This was despite Terry insisting that she was fine. And she had some cute shoes on. Without hesitation, a call was placed to 911 while another student sought help from nearby professors. It was the swift and decisive actions taken by these students that set the stage for what would become a chain event of life-saving events. Their ability to recognize the immediacy of the situation, remain calm under pressure, and their commitment to Terry speaks volumes about their character and their educational training. Katie, our administrative assistant, called and notified Terry's family of the emergency and directed them to go directly to JRMC. I myself, having worked with Terry for the past 18 years, and calling her one of my dearest friends, was not about to leave her. I'm so thankful to Andrew with the Jamestown ambulance crew for allowing me to ride along out to the hospital. 1 junior nursing student also accompanied Terry in the ambulance on the way to JRMC. In the ambulance, I witnessed Paige Erbstasser's compassion, her knowledge, and her calm demeanor during this high anxiety situation, offering not just medical support, but emotional reassurance. So tonight, Terry, who's here with us because of the actions that these students took, is here with us tonight with her family, along with all of us at the University of Jamestown. We would like to sincerely extend our heartfelt gratitude to the Jamestown ambulance crew, to Andrew and to Matt and to Paige, who was on call that day. And I'm so sorry, I cannot remember the name of the driver. What was her name? Chastity, whose professionalism and efficiency ensured that a stroke code was called into JRMC without any delay. To the JRMC emergency department crew and to the radiology team for their swift action and their care, and to everybody at JRMC, from anyone in the lab that helped Terry, anyone who answered the call, anyone who answered a question, took care of her family, to the teams at Sanford Health in Fargo, including the cath lab, the emergency department, and the neuro ICU. Everybody's expertise and coordination made a profound difference in Terry's recovery. Because of the collective efforts of our UJ nursing students, healthcare professionals, and emergency responders, Terry, along with her family, is here with us tonight. Her family and her friends and her colleagues and all who know her are profoundly grateful for all of this, and we thank you. We'd like to celebrate the courage, the compassion, and the quick thinking of these students and the professionals. Their actions remind us of the vital role that nurses and first responders play in our lives, often stepping into the most challenging moments with unwavering dedication. They have not only saved Terry's life, but they have also inspired all of us with their examples. I would like to ask now if anyone associated with the Jamestown Ambulance Service, Jamestown Emergency Department, or Jamestown Regional Medical Center Emergency Department, the Radiology Department, or the hospital in any way to please rise and be publicly acknowledged and thanked at this moment. Sincerely, sincerely, from the bottom of our hearts, we thank you. When I called the ambulance department and communicated with Tricia at JRMC, I think it's important for everyone here to know that these people respond in crisis and they act and they come and they pass that patient off, and they often don't know what happens to them. And so I'm just really thankful that we can say to you, because of your actions, we're celebrating Terry. So thank you, sincerely. On behalf of Terry, I'm going to invite the students forward, and I'm going to ask Terry, do you want to come up and hand them their certificate, or would you like me to ask somebody? Okay. I'm going to ask Katie, who's our administration assistant, to come up here and be my right-hand man or lady. If I could have someone from the ambulance service, maybe Andrew, come up. We have what we're calling a Guardian Angel Award certificate. Andrew with Jamestown Ambulance, are you here? And someone... Andrew was on call that day. We met in the classroom. Terry, you might not remember, but he was amazing. If we have someone from Jamestown Regional Medical Center who could come, Tricia, you would be amazing. The nurses are working. Do you see how that happens? All the nurses that are amazing are working, but Tricia's amazing, and she already worked all day. And now she's here to celebrate. Thanks, Tricia, for coming and bringing some representatives from the hospital. Okay, I'm now going to invite all the students up. I'll call you by name, and then the same will... Hello, there we are. We'll give you your certificate, and then you can stand behind us, and we'll get a group picture as well. Allie Battistoni. I'm going to just read these off, and you guys can make a line and then come up for a picture. Skya Brandon. We're not as organized as the other teams were. Wasn't sure if Terry would want to come up here and party with me. Paige Erbstasser. Kennedy Johnson. Aislinn Jordan. Megan Oswald. And Emma Pickrell. Okay, we'll have you all stand up front for one quick group photo. We do also have a certificate we're sending to Sanford Health to acknowledge their part too, because they played a very important role. So on behalf of Terry and all of us, we would like to thank all of you and honor you with what we're calling the Guardian Angel Award. Your quick actions had and are still having a profound impact on Terry's recovery as she continues with physical and occupational therapy. We are so proud of each of you. We are proud of all of our nursing students. It is with 100% confidence that I know any of you, all of you down there, in the same circumstance would have acted in the same way, and you all are going to go on to be guardian angels. So to the students, faculty, and healthcare teams, thank you for being the embodiment of what it means to care for others. And to Terry, thank you for your decades of service, your unwavering commitment to nursing education, and for inspiring generations of students to follow in your footsteps. We hope that your retirement, after you help us get through one class this spring semester, is full of sleepovers with your grand girls and gatherings with your friends and your family on the Sabbath, coffee on your patio, which I will surely invite myself over for, and Netflix series that are as good or better than Call the Midwife. So let us continue to strive for excellence, compassion, and readiness, just as these extraordinary individuals have shown us. Together, we can create a community where such heroic actions are always met with the support they deserve. Now, I don't know, it keeps shutting off. I would now like to invite my colleague, Dr. Penny Breeze, to the podium for just a few closing remarks. And again, I just thank you to all of you for coming tonight.
We would like to thank all of you for sharing your time with us on this frigid Thursday evening. Tuesday, excuse me, it's only Tuesday. Tuesday. Darn allergies, I don't know what else to say here. It's always special when we come together and celebrate our nursing students and their friends and their family and with our administration. And tonight we had a lot to celebrate. This was only a small example of how amazing our students are, all of them. So thank you for coming, and please do join us in the lobby for some refreshments. Thank you for coming. Congratulations.